Polypharmacy is most commonly defined as the use of 5 or more medications daily by an individual. However, the definition of polypharmacy is still debated and can vary from 2 to 11 concurrent medications. Some studies also generally define polypharmacy as the use of multiple concurrent medications or simultaneous long-term use of different drugs by the same individual. Hello and welcome to Medical Dialogues Journal Club. I'm Roshni Dhar and today I'm going to discuss about polypharmacy, a global risk factor for elderly people. World Health Organization has evaluated that in every 9 people there is one elderly people that is of age 60 years or older. This value is to be expected to increase to 1 in 5 people by 2050, accounting for about half of the total growth of the world population. Aging population is not just a concern for high-income countries. The majority of older people already live in low and middle-income countries, and this is where some of the fastest rates of aging are occurring. This demographic transition in the elderly population constitutes a significant challenge for health authorities worldwide, as with advancing age, multiple chronic diseases such as hypertension, diabetes mellitus, arthritis, chronic heart disease, renal disease, etc. are associated, as a result of which elderly people tend to take multiple medications in a day that can be referred to as polypharmacy. There is no as such standard definition of polypharmacy. It can be explained as the use of multiple medications, generally referred to 5 or more prescribed drugs per day, or the administration of more medications than are clinically indicated, representing unnecessary drug use. Polypharmacy is an area of concern for elderly because of several reasons. Elderly people are at greater risk for adverse drug reactions because of the metabolic changes and reduced drug clearance associated with aging. This risk is furthermore exacerbated by increasing the number of drugs used. Potential of drug-to-drug interactions is further increased by use of multiple drugs. In a case-controlled study carried out among old-age people, polypharmacy was found to be an independent risk factor for hip fractures. Polypharmacy may sometimes lead to prescribing cascades. Prescribing cascade is said when signs and symptoms of an ADR is misinterpreted as a disease and a new treatment or drug therapy is further added to the earlier prescribed treatment to treat the condition. The symptoms caused by polypharmacy is unfortunately usually dominated with the normal aging signs and symptoms, which can be tiredness, sleepiness, or decreased alertness, constipation, diarrhea, and etc. Evaluation of polypharmacy is of important concern in an elderly patient so as to avoid all the possible adverse effects. Comprehensive medication review and risk assessment should be carried out by interdisciplinary team to identify the polypharmacy and its adverse effects. It can be carried out using various tools like access, review, minimize, optimize, reassesses, screening tool to alert doctors to the right treatment. To reduce the incidence and adverse effects of polypharmacy, medication regimes of elderly patients should be evaluated monthly. A single agent should be prescribed instead of multiple drugs for the treatment of a single condition if possible. Medications should be started with the lower drug dosage where clinically indicated, and if required, incremental increase can be done. Identifying and avoiding the polypharmacy can lead to better outcomes in the elderly patients and also helps in improving the quality of life. Medication review is an essential part in the elderly patients to avoid adverse effects that can be caused due to polypharmacy. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.